76-year-old man has a raised lesion on his neck for 3 months that has rapidly grown. The lesion is painless but has bled on several occasions. He has type 1 diabetes mellitus managed with insulin and takes tacrolimus following renal transplant for an end-stage renal failure 6 months ago. A skin lesion is depicted in the image, which shows an erythematous keratotic raised lesion on the neck. Which is the most appropriate treatment? A. 5-FU, B. Cryotherapy, C. Radiotherapy, D. Regular 3-monthly surveillance, or E. Surgical excision. Now I just want you to pause the video here and take about 30 seconds to think about the correct answer. The correct answer is E. Surgical excision, and we'll go through why in the following slides. Squamous cell carcinoma is a malignant tumour arising from squamous cells of the epidermis. It is the second most common type of skin cancer after a basal cell carcinoma. It has significant metastatic potential, particularly in high-risk cases. It typically affects sun-exposed sites such as the face, ears, scalp, hands and lips, as with other skin cancers. Risk factors include chronic sun exposure, immunosuppression, as seen in this example as with a renal transplant and type 1 diabetes, and precancerous lesions such as actinic keratosis, Bowen's disease, which is SCC in situ, or any chronic wounds have a predisposition for developing and progressing into squamous cell carcinoma. Symptoms of squamous cell carcinoma include a firm, red, scaly plaque or nodule that may ulcerate, a non-healing sore or ulcer with raised ledgers, hyperkeratotic lesions that are thick and crusted and they may be tender, and any warty growths, especially on the lips or genitals, should raise suspicion for a mucosal SCC. Any skin lesion that develops pain, bleeding or rapid growth should raise suspicion of SCC. Here we can see some clinical images depicting SCCs, one affecting the ear, the middle picture representing Bowen's disease presenting as an erythematous patch, and the final picture showing a mucosal SCC on the lips. Investigations for an SCC should include a full clinical diagnosis to assess the lesion size, appearance and risk factors. Dermoscopy can be performed to help confirm the diagnosis and visualize any vascular patterns and keratinization. Biopsy is indicated with either a punch or excisional biopsy versus an incisional biopsy for larger invasive lesions. And imaging should be performed in high-risk cases or in suspected regional or distant metastasis, including a CT or MRI to assess deep invasion into surrounding tissues, a PET scan if metastasis is suspected, and a lymph node biopsy if nodal involvement is suspected. Management of SCC includes surgical excision with 4mm margins, which is first line. Mohs micrographic surgery can be considered for high-risk recurrent or facial SCCs, and non-surgical treatments for superficial or inoperable lesions can be considered, including cryotherapy for small, low-risk lesions, topical therapies for in situ SCC, known as Bowen's disease, including 5-FU or imicramod. Photodynamic therapy can be considered, and radiation therapy is indicated for large, deep, inoperable lesions, particularly in elderly patients who may not tolerate extensive surgery. Systemic therapy for those with advanced or metastatic SCC includes chemotherapy or immunotherapy. Complications of SCC include local tissue destruction with invasion of deeper structures such as the cartilage, bone or nerves, lymph node or distant metastasis, recurrence in high-risk lesions with inadequate margins or poorly differentiated SCC, and Marjolins ulcer describes an aggressive SCC arising from a chronic wound or scar. Just going back to our question, we can see the key features in this stem which suggest the need for surgical excision of this lesion include a raised lesion that has rapidly grown, a history of immunosuppression with type 1 diabetes and taking immunosuppressive medications following a renal transplant, and the clinical appearance of the lesion is a raised erythematous keratotic lesion on a sun-exposed site.